Nurse Paige here. Today I'll be teaching my patient about constipation and what that is and what they may come across and how I will help treat them for this condition. So constipation is passing fewer than 3 stools a week, having lumpy or hard stools, straining to have bowel movements, feeling as though there is a blockage in your rectum that prevents bowel movements, or feeling as though you cannot completely empty the stool from your rectum. So basically you'll have a lot of discomfort and you won't be passing what you intake from your body out daily. So some risk factors that can be associated with this condition would be being an older adult. So a lot of times the elderly will have a hard time passing stools on a regular basis. A lot of times this can be because they are elderly, so they do have more diseases, more sicknesses they can come across. Their immune system goes down and decreases in its sufficiency, and also they may get dehydrated easier, so that can also cause you to become constipated. Being a woman has been found to be increasing the likeliness of becoming constipated. Being dehydrated, that's another risk factor. Getting little or no physical activity. So physical activity has been linked, or lack of physical activity has been linked to constipation because you're not getting your body flowing and getting your fluids to go throughout your body and kind of push your waste products out. Taking certain medications, including sedatives, opioid pain medication. Some antidepressants or medications to lower blood pressure can also cause constipation, so they have side effects. Having a mental health condition such as depression or an eating disorder can also cause constipation. A lot of times, like your mood, like stress, depression, anxiety, can cause your body not to function normally. Also, eating disorders such as anorexia or bulimia, you're not eating enough and getting enough nutrition, so you're not intaking much, so therefore you're not excreting anything. Some complications you can run across when dealing with this condition is you can have swollen veins around your anus, which is called hemorrhoids. Straining to have a bowel movement may cause swelling in the veins. So when you're straining, that's what causes the hemorrhoids to get there. A torn skin or an anal fissure, that's another cause of constipation. Sometimes when you are constipated, when you're straining, you can get a tear, which is an anal fissure. A large or hard stool can cause this. Stool that cannot be expelled is called fecal impaction. Chronic constipation may cause accumulation of hardened stool that gets stuck in your intestines. So when these accumulate and get stuck in your intestines, then it can cause a chronic problem, and that can be more serious. Intestine that protrudes from the anus, so rectal prolapse. Straining to have a bowel movement can cause small amounts of the rectum to stretch and protrude from the anus. Some interventions I would do as a nurse would be having my patient include plenty of fiber in their diet, including things like beans, vegetables, fruits, whole grain cereals, and foods such as those will help increase the fiber intake, and it will help you to pass regular stools. Eating fewer foods with low amounts of fiber such as processed foods and dairy and meat products. So we want to eliminate those from your diet, and because those can cause constipation to worsen. Drink plenty of fluid, so you want to make sure that you're hydrated, because dehydration can be a risk factor, can be the reason why you're becoming constipated. Stay as active as possible and try to get regular exercise, so at least like 30 minutes a day for 3 to 7 times a week will help with this. Try to manage stress. Don't ignore the urge to pass, so if you have to go, go. Don't hold it in. Try to create a regular schedule for bowel movements, especially after meals. Make sure children who begin to eat solid foods get plenty of fiber in their diets, because children are also at high risk, such as infants and young children. Some lab and radiology diagnostics that we would take to show the reason why you're becoming constipated could be blood tests. So the doctor will look for a systemic condition such as low thyroid, which is called hypothyroidism, or high calcium levels, because this can be a cause. An X-ray can help your doctor determine whether your intestines are blocked and whether the stool is present throughout the colon. Another way you can assess, or you can diagnose a patient, would be examining the rectum and lower or sigmoid colon through a sigmoidoscopy. I think I'm saying that right. Sigmoidoscopy. In this procedure, your doctor inserts a lighted flexible tube into your anus and to examine your rectum and the lower portion of your colon. Just kind of take a look inside there to see what's going on. Examination of the rectum and entire colon would be a colonoscopy, and that's kind of similar. This diagnosis procedure allows your doctor to examine the entire colon with a flexible camera-equipped tube. And then evaluation of anal sphincter muscle function would be an anorectal manometry. In this procedure, your doctor inserts a narrow, flexible tube in your anus and rectum, then inflates a small balloon at the tip of the tube. The device is then pulled back through the sphincter muscle. This procedure allows your doctor to measure the coordination of the muscle you use to move your bowels. So the sphincter muscle is kind of what lets you release stool. So if that's having any issues, then that could be a severe problem. And then you can also do an MRI defecography. During this procedure, as in a doctor will insert contrast gel into your rectum. You then pass the gel. The MRI scanner can visualize and assess the function of the defecation muscles. This test can also diagnose problems that can cause constipation, such as rectocele or rectal prolapse. So there's various different diagnostic lab and radiology tests that you can run to check for this condition and why it's occurring. Some medications that you can get over the counter for this to help treat would be fiber supplements. You can do things simple as mix those in your daily fluids. You can get the ones that don't taste like anything. They have no taste at all. They're flavorless. Fiber supplements include psyllium, calcium polycarbophyll, and methyl cellulose. And then another over-the-counter medication that you can try is stimulants. Stimulants include Bisoscody, Cinosides, and then this will cause your intestines to contract. Osmotics is another medication that you could try to treat this. Osmotic laxatives help stool move through the colon by increasing secretion of fluid from the intestines, helping to stimulate bowel movements. And then lubricants, stool softeners, and enemas and suppositories are also other things you can try over the counter. Other medications, if these don't work and you need to resort to medications that are prescription medications, especially for irritable bowel syndrome, some of these would be medications that draw water into your intestines. So examples of those are lubiprostone, Trulance. Those are two examples of medications that would draw water into your intestines. It helps speed up the movement of stool. And then another one would be serotonin 5-hydroxy typeptamine 4 receptors. It helps move stool as well, and peripherally acting. Okay, anyways, there's a lot of ones that you can get prescribed by your doctor if the over-the-counter aren't working. If I'm going to assess my patient for constipation, I want to do a physical examination. So I'm going to do a general visual examination. You can observe their posture, their gait, and any lower back symptoms. And an abdominal examination is required to look for abdominal distension, pain, or tenderness. An inspection of the perineal area should follow to observe for any abnormalities, such as rectal prolapse, hemorrhoids, skin tags, lesions, scarring, or tears, and bleeding, fecal, soiling, infestation, foreign bodies, and general skin conditions. So you just kind of want to examine the rectum and make sure that you don't see any of these abnormalities. Otherwise, this could be a sign of constipation. And then some psychosocial effects that you could have if you do have constipation, or a lot of times it can cause your mood to change and be negatively impacted because a significant portion of the body's serotonin, known as the happy hormone, is produced in the gut. So when your bowel movements are off, your mood might be off as well. So it can cause you to feel depressed, and it can make you uncomfortable. It can cause physical discomfort as well as emotional. So you might feel cramping and bloating in your intestines that pushes in your stomach upward. As a result, you could feel discomfort and then just feel kind of like yucky. And I believe that's all. Thank you.